Hello everyone, this is Dr. Asmita Bhusal. I am pursuing MD in psychiatry at IOM and I'm a first year resident. In this video, I'll be talking about the things I considered while choosing my PG branch. I'll specifically talk about why I decided to take psychiatry. One thing you need to understand is that there's no perfect PG branch. Secondly, taking up a specific PG branch doesn't promise you huge amounts of money because it's entirely up to you and there are a lot of factors affecting it. So in my opinion, money should not be a determining factor while choosing a PG branch, or at least it wasn't for me. This brings us to our first consideration. The first thing is your interest or passion. If you are deeply interested in a branch, you don't have to worry about money, time, energy, or stamina, or anything else. While choosing it, you should go for it because nothing wins over interest or passion. And mind it, you'll have to like it both theoretically and practically. If you don't really have a specific preference, or maybe you like a lot of different branches but only the theoretical aspect of it and not the practical, like in my case, or maybe you're not interested in anything in particular, then you'll need to consider a lot of different factors. This brings us to our second consideration, and this is the most important one: work-life balance. To me, work-life balance would mean to have time for myself, to pursue my hobbies, or at least to be able to sleep on my own bed at night every single day. I hate night duties so much, and I also want to be able to dance, write and recite poetries, travel, and make videos and posts, vlogs, and so many more things. I want to be able to pursue all of this while still practicing as a clinician. I knew night sleep and mental peace were extremely important to me, so I ruled out all the surgical branches and other hectic branches like OBGYN, pediatrics, emergency medicine, and anesthesia. I wanted to be a clinician, so all the non-clinical branches were also ruled out. So medicine and the related branches were the only options left. This brings us to our third consideration: terminal branches versus branches needing super specialization. I wanted a terminal branch. I did not want to keep studying, super specializing, and keep giving exams my entire life. So internal medicine and subspecialties, or every branches needing a DM degree, were ruled out. I considered clinical branches like dermatology, psychiatry, and radiology because these three were the options left after ruling out everything. And this brings us to our fourth consideration: patient interaction. I value patient interaction and enjoy the entire process of being directly involved in the process of healing. And I personally do not enjoy reading scans and films as much, so this ruled out radiology very easily. This made me consider clinical branches like dermatology and psychiatry. To decide between these two, I had to consider a fifth factor, and that is my financial background. I belong to a middle-class family and am in no position to start a clinic with expensive equipment if I want a private practice later in future. But to be a practicing psychiatrist and have your own clinic, all you'll need is a desk and a chair and a room, of course, and that's it. I could afford to be a fully practicing psychiatrist, that too with a private practice, if I wanted. And this was a very, very important factor for me: the freedom to be able to set up your own private practice with minimal investment. This idea itself was so appealing to me. I'm already dreaming. And I love advocating and working towards bringing a change. Psychiatry resonated deeply with this part of me. The rebel kid inside me chose psychiatry when all my relatives wanted me to become something else: a gynecologist, pediatrician, cardiologist, and a neurologist, and whatnot. This is how I landed in psychiatry, considering everything. I hope this helps you frame your own steps and considerations while choosing the branch, and you get to decide to choose a brand that suits you and the life you want. I'm enjoying psychiatry a lot, except for the hectic 36 hours night duties, but this is only until residency, and knowing that keeps me going. So all the best, humans. I hope you all get what you want and you get the brands where you belong. Thank you for watching.